All right, everybody. Well, welcome. Welcome to Peer's August meeting. As most of you know, or many of you know who may have attended Peer's meetings in the past, Peer is a chapter of NYPAN, New York Progressive Action Network. We are also a chapter of Indivisible. Our work is focused on educating and advocating for social justice, healthcare, housing, and issues that reflect um, the needs of all Long Islanders as well as all throughout New York State. Peer and its members live on the Shinnecock, Montauk, and Manhasset nations of Long Island. We are on the east end of Long Island. So for those of you who are interested in learning more about how you might be able to join Peer, join our committees to work together on all these different issues, I'll drop that in the chat a little bit later, how you can join the organization. So though a lot of us, our neighbors and our friends, are living in great fear and anxiety these days, I want you, first of all, to remember that to take care of yourselves. I know a lot of my friends are suffering from high anxiety because of what they're have to deal with, ice on Long Island, the draconian measures that the administration is taking all throughout the state and the country. However, we must remember that we are part of a robust network of democracy defenders working throughout the nation, working hard to save our country. And so at Peer, we believe that resistance requires a vision for the way forward. We must resist, but we must also have that light, at the end of um, I guess, at the end of the horizon that beckons us forward to be able to create a more humane country are, once we get beyond where we are right now. And so our forum tonight is going to offer a vision for how New York State can take the lead in creating a more humane healthcare system and how we can achieve that. So I'm going to give you just a brief overview of what we will be going through tonight. So tonight's forum is called New York, Stop the Train Wreck, Pass the New York Health Act. I'm going to show a short video after I finish giving you this overview, and then I'm going to turn it over to the moderator, Cheryl Cashin. Cheryl is a member of Peer's core committee, which is our steering committee. Cheryl is a global health professional who's worked in the industry for over 30 years. She works with low and middle income countries to help them implement universal healthcare systems. Joining Cheryl on the panel are Martha Livingston. Martha has been at other forums that we've held on the Health Act over the years. She's a longtime healthcare professional teaching at SUNY Old Westbury, also a longtime member of the Physicians for a National Healthcare Plan, as well as other activities that she's engaged with in the healthcare industry. Melanie Dorigo, as many of you know, was a congressional candidate on Long Island. She herself is a former healthcare worker, and she is now the executive director of the Campaign for New York Health. So the three of them are going to be in a conversation on the New York Health Act. And after we conclude their forum, their conversation, we're going to start the Q&A with an overview by Dr. Eve Kreef. Dr. Kreef is a Long Island healthcare professional. She's a pediatrician, and she will describe the impact on her work of the big, ugly bill.
Next window to see who else
So I'm going to ask you to mute yourself if you're not already muted. And I will also ask you, as the forum goes on, drop your questions in the chat. And when we get to the end of the forum, Jerry Maslanka, a member of Peer's core group, and myself will monitor the chat and ask the questions. But we thought it might be kind of fun to start with a video which stars somebody who you may recognize. So I'm going to share my screen. Let me just figure out, let me hang on just one moment as I look for the share screen icon. There we go. Hang on just one second. I have just too many windows open on my computer to make sense here. Here we go. Okay, so I'm sharing this. Can you hear it? Okay, so you're not hearing that. You're not hearing it. Okay.
It looks like
Sometimes Zoom doesn't allow you to do that when you have a big group. So hang on a second. Let me see if I can. Patience, please. Can you hear it now?
No,
But wait, how do we get sound?
I
Okay.
opened,
Well,
Hey, Catherine, I'm going to drop a link in the chat. It's on their YouTube. I don't know if you want to try to show, or is that where you're trying to show it from the YouTube?
okay, so this is from Facebook.
Okay, maybe try the YouTube link. That might work better.
Okay, I don't have that. Can you?
I just dropped it in the chat.
Why don't you share your screen if you've got it?
Ah, okay.
How
Yep,
about that?
Sure. Oh, I just need sharing privileges.
Got that?
Yep. Give me one sec. Here we go.
Grab the wrinkly dog, 11 letters, and it's a rhyme.
Grab the wrinkly dog, and it's a rhyme. My apartment's on fire. It's right around the corner. Come on.
Whoa, whoa, whoa. First things first. Are you insured?
Yes, sorry. Here you go. If we could just hurry, though, that'd be great, because my apartment's literally on fire.
We got a slight issue here.
What issue?
It says here you're behind on your premium payments.
Really? I don't think so.
I do. It's right here on your file. $660.
Oh, my bad. Can we just take care of that later?
No can do. See, your specific provider, Bright Shield Protector Fidelity Horizon, says you need up-to-date premium payments for your provider to be reimbursed. Can you not talk over me?
I was talking with you to support you.
So the thing is, I haven't reached my deductible anyway, so it would all be out of pocket.
Right, but to get credit towards your deductible, you need to have up-to-date premium payments.
Okay. Sorry. Here you go. Here's my credit card. If we could just hurry, though, that'd be great, because my apartment is literally on fire.
So sorry, but we don't take American Express talking over me.
Oh, sorry. Here you go.
Actually, hold up. This isn't your home precinct.
It should be. I live right around the corner.
New address?
Yeah, we moved a couple months ago.
Well, that's an issue because your primary care precinct is still tied to your former address. This precinct is out of network for you, so I'm going to need a referral.
A referral? There's a fire in my apartment right now.
Oh, dear.
What?
Did you recently change jobs?
Yes. So what?
There's a gap in your insurance.
Your old coverage is tied to your old job, so when you shifted jobs...
My home is literally burning down.
Hey, could be worse.
How?
Was it on fire when you moved in?
No, of course not.
Seen it before, and then it's a pre-existing condition, and it's not covered.
See how it feels?
Kind of like it.
Oh,
What?
the crossword. Carpe Sharpe.
Nice pull.
This is absurd.
It would be absurd if we ran fire departments like this.
So why do we run healthcare this way?
Hey, I live right next door to you. Your apartment fire spread to my apartment.
Oh no, I'm so sorry.
Here, take a bucket. Can you help us?
Are you insured?
Okay. Thanks, Melanie. Save the day. Okay, Cheryl, on to you.
Thanks so much, Catherine. Good evening, everyone. I'm really, really delighted to see so many people here tonight to talk about this critical issue. So thank you for coming. We're here, I'm here because we got together with Pierre when that bill passed last month and we were raising the alarm bells. This was just a terrifying, to me, just terrifying change in what was already a really terrible healthcare system, that this bill is taking $10 billion out of a system, reducing our federal programs in the biggest rollback in American history of government support of healthcare. This is just hard to get our minds around. And so we wanted to come together and make sure that we make sure everyone in our community understands what's happening, how it's going to affect each of us, our families. but more importantly, what we can do about it. And that is really why we're here. We're lucky in New York, we actually have something we can do about it. Before we go to the panel, which I'm really delighted to be here with Martha and Melanie, I just wanted to share some facts, just as we talk about this and talk about the gravity of the situation, to have some facts at our disposal. I'm just going to share what some of the projected impacts are in New York of this bill. I'm going to share my screen now. Please tell me if that's working. Can y'all see that?
Yes.
Yes, okay. So I was just looking at how New Yorkers currently get our health coverage and who's going to be affected and how, just so we can get some baseline understanding of this. And what we know is that we have probably about 1.5 million people are going to lose access to Medicaid. And this is the direct target of this bill. And people have heard this figure, I think, but 1.5 million New Yorkers, because of new work requirements, because of other eligibility verification procedures, hurdles, red tape. There's a running theme through this, adding red tape, so people just give up and don't get the access that even they're entitled to. And what I don't think people are realizing is that there's also a threat to Medicare beneficiaries, that it's projected that 1 million low-income Medicare beneficiaries in New York are going to lose Part B premium subsidies and have higher costs for out-of-pocket drug costs. And we all have heard about people faced with choosing between paying bills and filling their prescriptions. That's going to get worse. And it's just that's horrible. Plus, about 100,000 lawfully present immigrants will lose eligibility to Medicare. And it continues. There's also an attack on people getting their health coverage through the Affordable Care Act exchange. In New York, we don't have quite as many of them, but these are self-employed people, entrepreneurs, farmers, small business owners. Everyone who is getting coverage through the exchange is going to face greater hurdles to enroll, to re-enroll. Eligibility and the enrollment periods are shrinking, and a lot of people rely on subsidies for their premiums, and they're set to expire. And I think we're all getting ready for that, for those to be allowed to expire. And then more people will lose their coverage if they can't afford the full payment of the premiums. And again, some categories of lawfully present immigrants will lose their eligibility for the Affordable Care Act exchanges. And what I don't think enough people are talking about is that the people who rely on their employers for employer-based coverage, thinking that they're safe, there will be spillover effects. When all of this federal revenue is pulled from our system, there's going to be cost shifting, and uncompensated care is going to increase, and that's going to show up in higher premiums for people who get coverage through their employer. So the point I just wanted to make, this is going to affect everyone, and we need to make sure that everyone knows this and is aware and prepared. The other part of this that I think we need to be aware of and prepared for is all of that federal funding is revenue for our providers, for our doctors and community centers, hospitals. $8 billion per year is going to be pulled from our hospitals and healthcare systems in New York. And I didn't realize how precarious a lot of our providers already are financially. There was a recent study by Kaiser Family Foundation that found that 52% of hospitals in New York are already operating on negative margins. So hospitals are going to close, providers are going to close. We are all going to face the consequences of that hit to our access to care. So I think this is something that is already layered on top of a very unsustainable, very dysfunctional health system, as we saw from that ad. This is what I've been calling a train wreck. This is our health system is on a track. It's a train going in one direction. Every year we're paying more, we're getting less, more higher premiums, higher out-of-pocket payments. On the other hand, we're getting more restricted networks of providers, we're getting more denials and less coverage. So the combination of this bill and that underlying dysfunction is what really raised the alarm bells for all of us. And we have a solution that we can talk about today, and that's what we want to turn to and hear about the New York Health Act and what we can all do together to get this passed. So let's start our panel discussion, and I'm going to invite Martha first to give you've been working on this for a very long time, Martha. You know the dysfunctions of our current system. What do you think is going to get worse with this bill, and where does the New York Health Act come in to help to solve this?
Thanks a lot, Cheryl, for that intro. Yeah, I've been working on this for way too long. I remember the late great Congressman John Conyers, who was the person who was the lead sponsor for Medicare for All in Congress for many years. And there was a meeting that we had where somebody said to him, he was in his early 70s at the time. Somebody said to him, "It's so great that you're doing this for your kids and your grandkids." And he said, "What are you talking about? I'm doing this for me." He didn't live long enough to see it. I hope I do. I'd like my kids and grandkids to benefit from it too, and everybody else's. Sure, fine. I want to step back a minute. I also want to say, Cheryl, that was a great intro, really good New York specific data. But I want to take us just a step back for a minute and talk a little more nationally, and then we can get New York specific and New York Health Act specific. And since we have the author of the bill on this meeting, if I mess up, I trust that former Assembly member Richard Gottfried will bail me out. But I want to just do a kind of reframe for a second here. We are fighting a defensive battle right now because the bad guys are coming at us full tilt. They don't just want to destroy Medicaid. They want to destroy Medicare and Social Security too. It affects everybody, as well as the institutions, which you mentioned, which I think is a really important point. Because if you take away Medicaid funding, hospitals will not be able to provide care to anybody as well as they currently can provide care. That's true. Best offense, remember this, the best defense is a good offense. So what we're going to do here is not just fight against the cuts, but provide a vision to people that says, yo, healthcare is a right. We really don't get that here. People don't get it. We're hanging on by our fingernails. Those of us who have it, we're like, ooh, it's such a pretty idea. I wish that could be true. But gee whiz, my union is fighting tooth and nail to keep the benefits we have. Yeah, that's the point. Until healthcare is a right for all of us, it's a right for none of us. And what nobody on this call has, unless, I don't know, Elon snuck on the meeting and I'm not seeing him, none of us has healthcare security. I'm as well insured as could be. I'm a state employee, blah, blah, blah. What if I got really sick, God forbid? What if I lost my job? I'd be SOL in a heartbeat, right? We can all play out that scenario. We all have enough healthcare horror stories that we've heard from people we care about to understand that until all of us have healthcare security, nobody has healthcare security. We are so messed up in this country that a murderer has become a folk hero. Everybody knows the young man who murdered the United Healthcare CEO. I don't do a lot of social media, but there are people who idolize this guy. I actually have a picture of Luigi, the murderer, as Jesus. I mean, there are people who really think the system is so broken that it's okay to kill people to fix it. I'm not in that camp. I never will be in that camp. But isn't it interesting that everybody hates the current, hates what's going on in the current healthcare system? That video really encapsulates it perfectly. So what I want to do is just look at a couple of things as an overview, and then we can get more down into the weeds. So first of all, whenever I think about healthcare, I think about the three major ways to really want healthcare. The first is the economics of it. We have the right answer. We get corporate greed out of the healthcare system, we have more than enough money in our system, both federally and in the state of New York, to cover everybody for everything and save some money at the same time. Sounds crazy, but it's true. So we have the economic argument. We have the public health argument. If everybody isn't covered, and I'm riding the Long Island Railroad, who am I sitting next to? Oh, they're coughing. I have a mask on. That's nice. Maybe they have TB because they came from, et cetera, et cetera, et cetera. You can write the script. Until everybody has access to care when they need it, we are all vulnerable from a public health standpoint. Third point, and I frankly think the most important point, is simply this: morality. It is immoral in the richest country on the planet for anybody ever to go without needed health care, period, the end. I was in a meeting one time when somebody was questioning Bernie. And they said, why should I pay for that person who blah, 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 blah? You know, whether it was somebody who smoked and drank or was here, you know, undocumented or whatever, why should I? And he said, because she's a human being, for crying out loud. That really cuts right to the chase. That's the point. Healthcare is a human right. I want to talk a little bit now about divide and conquer, because we have a mentality that's been foisted on us, especially by the Republicans, of the deserving versus the undeserving poor. And it makes me throw up because I never hear them talk about the undeserving rich. Anybody here ever hear that? No, you didn't. When we look at who's actually on Medicaid, you hear this language from Reagan's time, right? It's like the welfare queen line. You heard that guy, the Congress member in a town hall in Nebraska last week. That's gone viral, where he talked about how why should somebody who doesn't work have access to health care? And he got roundly booed. It's nice to know there are some Democrats in Nebraska. But the point is, who's on Medicaid in the United States? First of all, Medicaid accounts for a little over 17% of total spending. Who's on Medicaid and CHIP combined is about 79 million Americans. So that's huge. 41% of all children are on Medicaid and another 10% on CHIP. So right away, more than half of who's on Medicaid is kids. Sending them out to work now to get their Medicaid. Half of the people who are on Medicaid have incomes less than $50,000 a year. 84% of them are US born. Another 6.5% of them are naturalized. So 9.2% of Medicaid recipients are non-citizens, none of them undocumented. So all that BS argument that you hear all the time, it's just, that's what it is. It's BS. You can go to the Pew Foundation website to get these data. These are from January this year. 20% of Medicaid recipients are elderly, blind, or disabled. The vast majority of working age recipients who are on Medicaid work. So those who are of working age and don't work are either disabled or caregivers, or they're in school. So this image of these undeserving poor people ripping us off for healthcare is complete BS. Complete BS. Now what the big ugly bill will do is throw millions of people off Medicaid who are absolutely legitimately on because of all this paperwork reporting requirements, which is just an absolute waste of our taxpayer money. So that's one piece of the story. The other piece I think that's really most important for our group is I don't know everybody on this call, I know some of us, we're pretty well off. The argument that, messing with Medicaid is going to affect us personally is still really cogent because of the issues that Cheryl has raised. And I think that Melanie will be raising, and that is that cuts to Medicaid are cuts to the healthcare access for all of us. Another point that's, I think, really important to make on the island, especially in counties other than New York City, is the property tax argument. That is to say, the lion's share of municipal and county property tax go toward funding the health care of municipal and county employees. It would be an enormous property tax relief were we to go for the New York Health Act. It's a point I think that doesn't get made sufficiently. Not sure why not, but I think it really needs to be a major point that we make. So my basic 2 points are, it's important for all of us because none of us have health security. Even those of us who are well-heeled will do better with the New York Health Act. And I think my final point has to be, this is impossible to believe, Martha. What are you, selling me a used car? We can get all of that health care and pay less for it and have it be secure and never go away. Yes, we can do that. In fact, it's the right answer. I know that Catherine, I think, is going to drop in the chat Richard Gottfried's document called All About the New York Health Act, which has the deets in about 6 pages of well-written verse. Cheryl already did, good. So it's there for you. So just pull it up so you don't lose it, because once this ends, you'll have a reference point that I think you'll find very useful. So I think the main point is the majority of New Yorkers hate our current healthcare system, even if we're relatively well insured. We are losing money in our paychecks because healthcare gets more and more and more out of control expensive. The real problem is not that New Yorkers don't want the New York Health Act, it's that they never heard of it. And that's where we come in, and we can do all kinds of things about getting this message out to people. I personally am happy to come to groups and talk to groups about the issues. One issue I'll mention is that as a union member and union activist, there are issues specific to union members that union members are concerned about, because we have given up so much in order to keep our healthcare coverage, that the idea that suddenly we're not going to have to do that anymore seems in a way like a loss to some people. Like, oh, my union isn't going to be responsible for my healthcare anymore. What a relief that will be. And I can introduce anybody on this call to unionists in Canada, where I lived for several years, who, like everybody else in Canada, pretty much like 97% of Canadians, love their healthcare system and will tell you how good it is, and don't believe a thing you read about Canadians not getting the healthcare they need. Are there issues? Yes. Are there problems in everybody's healthcare system in the world? Sure. Every other wealthy country in the world has figured this out better than we have. Let's do it. And why are we focusing on New York? Because take one look at what's going on in Congress right now, and you know that we have to focus on a statewide plan. And we also know, by the way, that Canada did this province by province. They started in the province of Saskatchewan in 1962. They arrived at at coverage for everybody in every province by 1971. We can do this California's trying. I would love us to beat out California. So, so that's my,
Yeah.
let's do it.
Thank you. And yes, I think you hit on a few points that I really want to make sure that we all take on board as we go out and talk about this bill. I think this idea that we can't have nice things, that we don't understand healthcare as a right. We also are the only country in the world who relies on private for-profit insurance for basic health coverage and all that goes along with that. And some people here might be surprised to know that that doesn't only apply to what we get through our employers and others. Medicare now, more than 50% of enrollees are getting their insurance managed by private insurance companies through Medicare Advantage, 75% of Medicaid through Medicaid managed care private insurers. And all that's 30% of profits, marketing, administrative costs instead of to our care. So no other system is organized in this way. If you take that money and funnel it back in, we have enough. And I think the other point you made about the hidden costs that we overpay for our own healthcare, and then we overpay again through our taxes for the healthcare of public servants. And the Long Island analysis, I looked at the Suffolk County data, $700 million a year goes to healthcare for county employees. And that comes out to $1,400 per taxpaying household in Suffolk County. So these are huge costs to get less and less every year. And the New York Health Act is a very simple solution. I think we put the flyer in the chat, but the headlines are, this is one health plan for the state that is extremely comprehensive. It's more comprehensive than any plans any of us have right now. I think includes long-term care because it uses the money so efficiently. It's paid for by a progressive tax instead of right now, premiums and deductibles are a tax on the sick, and it's completely harmful and doesn't generate enough revenue. And there is choice. The other thing people always ask about is, well, won't I lose choice? Nobody wants choice of health insurer. They want choice of hospital and doctor, and that will be completely available under the New York Health Act. So it's not too good to be true. This is real. It's possible. It's been analyzed. It's been perfected. Melanie, where does it stand? Are we close to is this real? Can we get this passed? Where does it stand? And then what can we do?
Yeah, so it's very real. It's been very real for quite some time. And I'm sure, Dick Gottfried, who's here with us, can attest to that. Look, here's what I'm going to say. Most of you on this call, I know most of you, I've organized with so many of you. I've been in a lot of spaces working on a lot of issues. And one thing that I think is remarkable about the base of support for this bill, as well as Medicare for All on the national level, is that we have the most passionate, the most empathetic, the most relentless supporters out there across any issue. I've always thought that, and as I've had the extreme pleasure of getting deeper into the work, I can say that is 100% true, and that is how I know that we will win this bill. Where it stands today, let me take a step back and say, the honorable and amazing Dick Gottfried, who is very much in this fight each and every day, bless him for retiring and choosing to put so much of his energy into this movement. You can tell he's a real one, right? He's a really incredible, was a really incredibly authentic legislator, and he's still in this fight with us, which is amazing. So thank you, Dick, for really showcasing what leadership looks like for all of us. He wrote this bill in 1991. And some people hear that and they think, oh, well, forget it. It's been around forever. We're never going to pass it, right? But I actually have a completely different perspective on that. When we think about really impactful, transformational legislation that have completely changed the way we operate, whether on a state level or a national level, these movements of change have taken quite some time, right? So the fact that this bill is still around, is still gaining traction, is still bringing in new folks, I think that shows the strength. So I know Martha, went over a little bit the moral case, right, for the New York Health Act, which, by the way, we've always had. We've always had the moral high ground when it comes to this bill. For a long time now, we've had the financial argument as to why this bill makes sense. I think what had been missing is the political moment, right? We have not had the political moment to move this bill. And some people will say, well, what about COVID? Wasn't that the political moment? And to that, I say, do you remember the height of COVID? I mean, we're still dealing with it, but the very height of COVID, were you able to do anything? Because, I mean, we were Cloroxing bananas and we were terrified that we might die and we didn't know what we were going to do, who was going to take care of our children, right? These are real conversations we were having. That was not a time to tap into energy. This political moment, as we are navigating Trump 2.0, kind of a much worse, much more chaotic, vindictive, harmful, intense 2.0, right? Where we're seeing things happen at I think, a much more rapid speed than any of us initially anticipated. Something else is happening, right? We're not afraid. We are filled with rage, right? And rage is something we can work with because when people are angry, people tend to want to act, right? And not only had we been dealing with a very broken healthcare system for a very long time. Like let us not pretend in any way, shape, or form that the healthcare system was working before this reconciliation bill was passed. But now Trump has given us, he's become a super villain, right, in the healthcare world. And I want to be very careful about how, these next few words because I want to hold space and recognize that this is a devastating time because we know that these cuts will translate into sicker neighbors. We know it means people will die. And that's very heavy. That is very, very serious. And those are the stakes, right? People's lives are on the line right now. And you know, unfortunately, you'll hear this in pretty much any nonprofit, you know, around the world. Anytime there is a devastating event, right? So if there's a school shooting, that day is when, you know, Moms Demand Action sees a rapid increase in subscribers and membership, right? Because that people feel like compelled to act. And so what these cuts have done is really unite folks around this idea that, and I love what Cheryl said, that we can have nice things, that maybe we actually can do this. And I think what's different in this, you know, 2.0 presidency versus the first, and you know, if we think back before the 2020 Democratic primary, we had never seen a presidential debate where candidates were debating Medicare for all and universal health care and these concepts, right? And so I know we all harbor a lot of feelings about the 2020 Democratic primary, but that was real progress, right? That moment, I think, changed the way people view universal health care. It normalized it. It stopped treating it as this radical policy issue that was sort of pie in the sky. And I think that was sort of, I think, the beginning where people started to think that, hey, maybe we can do this. Maybe this is something we can do, right? And so now we're at this time where, as I said, we've got morality on our side, we've got the fiscal case, now we've got the political moment. So I really do believe that right now, and look, you all know me, you know we are committed to passing this bill as soon as possible. I wish I could tell you, yeah, they're going to pass it in January. I don't know that that's likely, but I know that our movement will continue to grow and intensify. And I think we're going to make our legislators' lives really difficult if they choose to turn their backs on the people. The way I look at government, the way I've in my most optimistic times, you know, and I think in my heart I still believe that government should work for people. That is its function. We know it gets corrupted. It doesn't always work that way, but government should work for the people. And when we have threats and when we are being attacked, it is incumbent upon our legislators to step up and protect us. And so I think New York State has an incredible role to play. They've got a responsibility and this incredible opportunity to step up and pass this bill and protect us all. So I know I'm probably running out of time, but I want to quickly just address where are we at? How does it pass? This is important. We have very much three levers of power that can legislatively move something. And of course, there are a lot of other variables. I know Martha mentioned, labor, there's public support, right? There's all kinds of pieces here. We've got our assembly, we've got our state senate, and we've got the governor. The assembly behaves very differently than the way the Senate behaves, and the governor behaves in a in a very frustrating manner. But she's got her own way of legislating as well. And so, what we've been working on from a campaign perspective is not just trying to, come in with our, pitchforks and guns blazing, if you will, but really trying to be strategic and thoughtful around what are the levers of power, and who really makes the decision, and how do we influence that decision in a way that keeps the relationship cordial and moving forward. Because what we've learned is that once you burn that bridge, it's very hard to rebuild it. Right? It's very hard to rebuild it. So even though we might want to burn a bridge, it's not the smart play. So we're working with that, and I'll just quickly say that we are a couple weeks away from launching a very comprehensive campaign to pressure the legislature, as well as educate our communities and really build our public support. I know we talk a lot at PEER and NYPAN and other groups who are on here. We talk a lot about this idea of community power and how we leverage our collective power. This is an opportunity to see that in action. If we can harness the collective power of people across the state, we will move this bill.
Thank you, Melanie. I really appreciate that optimism in this moment. And something that I've heard you say that I really appreciate is that in the past, we approached this as the government has the responsibility to make our healthcare system better. But this moment, it's to salvage it. It's a whole different mandate. And the alternative is far more dire than it was a year ago to not have this. So
Absolutely.
to do the responsible thing, they have to take that chance.
And if I could, Cheryl, just add, like, as much as we would love to believe that our legislature and our governor are actively, strategically thinking about the future. Oftentimes they're not. They're thinking in 2-year cycles. They're thinking about, or at least, the Assembly and Senate, they're thinking about their next reelection. And I've had, senators say to me point blank, I like this bill, but how do I explain this in a 2-year cycle, right? And so these are a lot of the challenges that we're facing. And our legislature as a whole tends to be very reactive. They're not a proactive legislature, and it's not unique in New York. This is kind of across the board. And I think this moment gives them the cover of being reactive, right? Because it's not as if we're asking for progress, we're asking for protection. And I think that is a more comfortable place for them to be, which gives me hope that they'll actually move the bill.
Great. Thank you. I think we had some really great questions in the chat, so maybe I'll pull from there rather than posing some of my own questions. I think they fall into two categories, and one of them, let's start with the bill itself. And I'm in the area where I work. I'm always very concerned about the revenue for healthcare providers and how we're making sure that they're getting paid in a way that they want to participate and they're going to be able to deliver good quality care. And I think this bill is really unique in how it pays attention to that part of things. And I know there's a question in the chat. What does this mean for how hospitals and doctors get paid if it's all coming through this one plan, this one payer? And how do the big hospital and healthcare networks feel about this? And I'm going to throw this to, since we have Assemblyman Gottfried with us, maybe you can answer that. I know you've given so much thought to this and have done such incredible work on that part of the bill, of all of it, but this in particular really impressed me.
Yeah, well, the bill has several guarantees in it that doctors and hospitals and others will be well paid. The language describing the criteria for setting payment methodologies was drafted largely in consultation with the Medical Society of New York State, who I assure you is very focused on making sure that healthcare providers get well paid. The bill is very explicit that it states that Medicare and Medicaid not only do not fully cover the cost of the services they cover, and everybody knows that, but it makes explicit that the New York Health Act will pay more than Medicare and Medicaid pay. And how do we do that? Well, first of all, we save about $26 billion a year by not paying for insurance corporation marketing and bureaucracy and profit. We save healthcare providers about $22 billion a year by saving them the administrative costs of fighting with insurance company bureaucrats. And finally, we save, I think it's, if I'm remembering right, it's about $15 billion a year by bringing down drug prices, thanks to the bargaining clout of 20 million covered lives bargaining together. You put all that together, and you've got $60 billion a year in savings. And yeah, the bill is also going to spend more money. We're going to be picking up out-of-pocket costs about deductibles and co-pays. We're going to be picking up, we're going to be paying healthcare providers billions more. We're going to be covering long-term care. You add up all of that increased spending, that's about $40 billion a year, which means we're going to have net savings of about $20 billion a year under the New York Health Act. Now, that's not magic. It's arithmetic. And the arithmetic is not something that, that I or Melanie DeRigo made up. There have been any number of studies done of the New York Health Act and other state plans and national plans done by the RAND Corporation and other independent consulting firms and various academics. And they all come to pretty much the same conclusions, that there will be these billions of dollars of net savings just in New York State, forget about nationally. And the bill, as I said, guarantees that healthcare providers will be a whole lot better paid. Our insurance premiums, among other things, the way hospitals deal with people who don't have health coverage at all or are covered only by Medicare or Medicaid that don't fully cover the cost of care is our insurance payments cross-subsidize those other patients. Well, under the New York Health Act, that will not be necessary anymore. There will no longer be medical debt, paid or unpaid. You will no longer have patients with coverage that doesn't adequately cover the cost of care. And so doctors and hospitals and physical therapists and all the rest are going to be a whole lot better covered. And I think that's partly why some of the longest standing and strongest advocates for the bill are the New York State Nurses Association, which was one of the groups that talked me into supporting the concept of universal coverage and worked with me to draft the New York Health Act. 1199, the Hospital Workers Union, and they cover also home care workers and others. They strongly support the bill. They wouldn't be supporting the bill if their members weren't going to be well paid.
Thank you. Exactly. If you're putting $40 billion into care instead of into profits and marketing and admin, that's got to benefit the providers as well. So that other question in the chat about the larger hospital systems and corporate providers, do we know, have they been vocal in either direction? Does anyone know the answer to that question?
I'm sorry, can you repeat that, Cheryl?
So the question in the chat about some of the bigger health systems and hospital systems, more corporate providers, how are they standing on the bill?
Well, one of our biggest hospital networks, the New York City Health and Hospitals Corporation, New York City's public hospitals, strongly supports the bill. and have for several years now. The other hospital systems are not on board, and they're just very concerned that, oh, if we're dealing with one big payer, how do we know we're not going to get screwed? And I can understand that fear. And we've been trying to persuade them, read the bill. You're going to make out very well under the New York Health Act. Ask the unions that represent your employees. They know that the hospital system is going to make out very well and pay their workers well. So yeah, we've got an uphill climb. Part of the problem is that hospital systems, their boards of directors are made up overwhelmingly of very wealthy people in the corporate world. And people in the corporate world, when they hear government program, they think, oh my God, we're going to get screwed. Well, that's not true. The corporate world is not screwed by public schools. They're not screwed by the fact that the Thruway and other major roads are public roads. The corporate world is not screwed by Social Security and Medicare. And they're not going to be screwed by the New York Health Act. They, in fact, going to save billions of dollars that is now being ripped off from them by paying the inflated costs of insurance companies. But I can understand that, if I was a multi-million-dollar corporate executive and somebody was proposing the New York Health Act, I'd probably be skeptical too.
Right. And, just to piggyback a little bit on that, we also have to remember that all hospitals are not created equally, right? Some hospitals are these large conglomerates that are driven by private equity or largely owned by private equity. Those folks are not centering your care, they're centering their profit, right? So I think we like to think of hospitals as, oh, these are the good guys, right? This is my local hospital. We have a fondness for them. We totally different when we think about insurance companies, right? We kind of have like anger toward them. But I think, yeah, the hospital world varies greatly. And look, like the truth of it is that we're not going to bring everybody on board, right? I'm seeing a lot of the questions in the chat about the insurance companies and how do we deal with them? They are going to be our adversaries, right? Let's go into that very eyes wide open. They are. They just will be. That doesn't mean we don't fight. That doesn't mean we can't continue pressuring our legislature and our governor, to the extent that we can. I think that, look, I say this all the time, right? Insurance companies, that the entire industry is a social construct, right? There's no reason for them to exist. They exist to make a profit. They do not exist to make healthcare. The end. That is what they do. They are not in it to give you, a special wellness program or to give you care. That's not what they're there for. The more they deny you care, the more profit they make. And I think we've all seen this. Their quarterly profits go up and up and up and up and up. That's at the expense of us. So you know what? Like, I'll put my gloves on. Let's go. They're going to be our adversaries. Our job is to keep building support and keep talking to people, because this moment where everything is so chaotic politically, there's such a silver lining in terms of opportunity. And it's in these moments that the scale tips. So we've got to stay clear-eyed and really focused on our job, which is to build support.
Thank you, Melanie. I have talked to people who work in the insurance companies, not the big executives, but the people who are denying claims, and they would be very happy to have a different role in our healthcare system, a different kind of job. And I think that we just have to think about this way. There are just some jobs that are not adding value, but there are other jobs that people can do that will add value. And there is that discussion among people who work in that industry. I also want, as we're continuing to talk about how healthcare providers are experiencing the current system and how that would change under the New York Health Act, maybe it's a good time to invite Eve to share your perspective on this. As a pediatrician, you're right there. Like, what do you see as the current situation, how it's possibly going to get worse with the new bill, and how the New York Health Act would affect your experience?
Yeah, I mean, like Melanie said, I mean, this is a political moment that wasn't there before, and it's as good a time as any to really take advantage of that. I mean, I just know providers like myself are just just really very, very just waiting for that ball to drop when this all hits. It's going to be really, really bad. There's just no way around it. I'm worried about my patients. I'm worried about our hospitals, and I'm worried about practices like mine. That often live month to month. I've gone months without taking a paycheck. It's not easy to run a practice. As far as my patients, I worry that they're going to lose coverage. And that's why our American Academy of Pediatrics, we've been very, very active, speaking out against this bill, going to DC, meeting with our legislators to really push back against the reconciliation bill, because we know that nearly 50% of children rely on Medicaid. And they also just decided that they're not going to allow us to access the continuous coverage for children that we pushed really hard to pass here in New York State. Right now, children have automatic enrollment in Medicaid from 0 to 6 years old. They don't have to apply to re-enroll every year. And what this bill does, having people reapply every 6 months, that's the reason we were able to pass this bill, because we explained to legislators that the overwhelming majority of people who reapply for Medicaid qualify for it. And this is just going to, put people in a quagmire, people who are already struggling, who are working, more than one job, who have young children, expecting them to go through this paperwork. We know it takes months, sometimes, many, many months to recertify for Medicaid. So, we've often had patients come to our windows and they didn't recertify. They don't have active practice. So it's either seeing those patients for free, which we'll often do if these are sick kids or, behind on their vaccines, or help them get, recertified on the spot, which takes the time of my staff. So, the 0 to 6 continuous coverage was an amazing thing, which we're not going to have anymore. And we know that, those requirements to re-enroll in this bill are going to throw off people that rightly deserve and should be, on Medicaid and should have their health care. And I'm worried about my immigrant population who all children qualify right now for Medicaid and Child Health Plus in New York State, and they can't now. Our TPS population, our patients that might just, a parent just has a green card. They're really just, people are not going to be eligible. People are going to be struggling. People are going to be afraid to come to the doctor. We're already seeing that, right? Because of the immigrant situation. So, I'm worried about our hospitals because anywhere from 60 to 80% of children's hospitals get their funding through Medicaid, right? So, with $15 billion, $13 to $15 billion less money coming from the federal government to New York State, like that's just going to flow down to our hospital systems, and they're not going to be able to function. We know that many hospitals in rural locations are going to close, but children's hospitals are going to close because such a large degree of their population is on Medicaid, and they get so much of their funding from Medicaid. So they will close, and if they don't close, they're definitely going to cut the services that they are able to provide. They're definitely going to cut staffing, and it's going to affect local economies of people who work in our hospitals. And it's going to affect the services that you get when you go to the hospital. Your wait times are going to be increased because they're not going to have the staffing to be able to see all the patients. But the quality of care will not be as great because there won't be as many people there to take care of you when you're in the emergency room. And many of the local hospitals that serve high Medicaid populations are going to close. And, we know it's common sense, right? When people have healthcare coverage, then we ultimately save money because less people are sick, right? So if we have less healthcare for people, more people will get sick. And I think about that ad that you showed at the very beginning. There's a fire, someone shows up to the emergency room, and we're going to care for them, right? They're going to get care, and that's going to obviously fall down to all of us. With hospitals, rising costs are going to fall upon our premiums. Everyone's premiums are definitely going to rise with all of this. So no one is, even if you're not on Medicaid, nobody is exempt from the effects of this bill. And specialty care, pediatric specialists and all specialists across medicine aren't going to be able to provide the care that they normally do. So we're going to have less access to specialists. We're going to have less access to hospitals. Our premiums are going to rise. And all this is going to happen. And again, the way they've laid it out, it's going to happen gradually. Some things are going to start in 26, some in 27, some in 28, but it's going to hit. And ultimately, people are going to get sicker. People are going to die. And there is no time like now to try and sell this bill to avert some of this really very real damage that is surely going to be taking place over the next couple of years.
Thank you, Eve. It's a really grim picture. Can you do you know where like the AMA or other provider associations stand on the bill in New York or Medicare for All in general? Where are the providers?
I don't know about the AMA. I know our American Academy of Pediatrics supports it. We've had a memo of support for some time now. So yeah, it's just keep pushing, please.
Here, yes, keep pushing. Martha, please come in.
Yeah, so in general, the primary care specialty organizations are much more supportive of this concept than some of the ultra specialties. But what I would like, Dr. Kreef, the picture that you painted was really important, and you didn't talk at all about your life as a pediatrician and how the current system affects you, as well as how these future changes would affect you. Can you speak a little bit to that?
Yeah, again, I mean, I probably have about 30% of my population that's on Medicaid right now. And again, when patients come to the door, before we had the 0 to 6 coverage, it would just, a lot of them did not have their papers in order, and sometimes we have to eat those costs. So when this passes, it's really going to be very, very difficult to sustain small practices that rely on Medicaid for their payments. They're going to, right now, Medicaid covers so much of the care that I provide as a pediatrician, to provide some developmental screenings. It covers vaccinations, it covers everything, well care, illness care, and it's all covered through Medicaid, which pays, pretty well for this kind of preventive medicine. And the services are going to be cut with that amount of money, that level of billions and billions of dollars, of less funding coming to New York State. Even if they have a cushion right now, that cushion's going to run out. They can't, $13 billion a year. Cuts are going to have to come somewhere. And children, unfortunately, usually are at the bottom of the totem pole, and because they don't have a vote, right? So they tend to come last and then prioritize last. That's why pediatricians make less than any other pediatric specialty, but we're the happiest because we love what we do. But it's going to be hard to keep our doors open, honestly, if we're not getting that. If we get less than what we're getting now, it's just not going to be worth it for pediatricians to go into the field. They're not going to be able to pay back their school loans. It's everything's going to snowball and impact care and just availability and existence of practitioners who aren't going to go into the field.
Thank you. Just maybe one more set of questions. I'm going to hand it over to Catherine to keep going with the chat, but there's always questions, and there are questions in the chat, but we always hear questions about people who are covered through other mechanisms. So what's going to happen if I'm currently covered by Medicare and I've been paying into that? What happens if I'm currently covered by the county government and I bargained for that and I have, what happens? Are people what are they going to experience if everyone is covered through the New York Health Act? I don't know if, Martha, can I turn to you, or Assemblyman Garfield?
There was one comment in the chat, and I'd love, Dick, for you to pick up on some of this, but I think that some people have an idea that somehow I'm getting care because other people aren't, because there's a zero-sum game, and oh my God, if everybody can get health care, I'm going to be waiting on a long line around the block to get care. Well, that's just not going to be the case. What is going to be the case, apart from all the other things that are going to be better, is that our doctors are going to be able to see more patients. Why? Because they're not going to have to spend hours and hours every day clicking a button. My primary care doc, I've already, he's talking about retirement. The guy just turned 60. What is he talking about? I made it clear to him that he's not allowed to retire until I'm dead. But the point, and I interviewed him once, I conducted a lengthy interview, and the thing that drives him and so many other docs crazy is the nonsense paperwork. I think, Dr. Kreef, that what's interesting is that because so many of your patients are on Medicaid, you're actually dealing with a little less of that than other primary care docs who are dealing with people with private health insurance or without private health insurance. But I know that my doc says he loves to see patients all day long. It's spending his entire evening every evening, and sometimes until midnight, clicking buttons to make sure that the insurance company knows what he did. It's just a waste.
Yeah, I definitely do that as well. So we don't see any less of it in pediatrics, trust me. It's awful.
Right.
Yeah.
And I have to say that having lived in Canada and having done research on healthcare in Canada and talked to Canadian docs, I've actually asked primary care docs to estimate for me what time and effort it takes for them to bill for their services. And I've had time and time again, I've seen examples in the movie Fix It. You see a practitioner typing stuff in, and it was 13 seconds per patient visit. And I've had docs estimate for me that it takes them, give or take, and I had somebody sit there like calculating this, 20 minutes, half an hour a week, just to enter a code. Martha came in, code for office visit, code for Martha, send it off. Here comes the money in 2 or 4 or 6 weeks, depending on the province. I mean, that's it. That's what we're talking about, the administrative simplicity that takes the money that gets pissed away on this nonsense and gets spent on healthcare instead. I'm not sharing, but I see that Dick Gottfried's hand is up.
Yeah, doctors, the various consultant reports that I was talking about document that doctors in New York spend about four times as much time each week on administrative work dealing with insurance companies as their counterparts in Canada. And, my family doctor, who, like Martha's, is also going to retire at some point, which scares the daylights out of me and my wife. But anyway, he does not accept any insurance. And the only insurance he does accept is traditional Medicare. And if you ask him why, he says, I send them a bill, they send me a check. Nobody else does that. And that's how the New York Health Act is going to work. And, so much of what makes the delivery of healthcare a pain in the neck and expensive and throws away tens of billions of dollars a year on things that have nothing to do with making people healthy, getting rid of all that is really a core benefit of the New York Health Act. There are all sorts of people, even people in the insurance industry, say, "Oh, we agree, everyone should have health coverage," but there is no proposal on the table in New York that comes close to actually doing that, except the New York Health Act. Because unless you have the enormous savings and efficiency that come with the New York Health Act, there's no way you can get rid of deductibles and copays and cover the uninsured and cover long-term care and make sure that hospitals are well paid.
Thanks, Dick. I appreciate that. And I'm just going to hop in here because we've had a lot of really good questions in the chat, some of which have already been covered. But there's a couple that are outstanding. A few people have asked this, including Francesca. How are we going to get the money from the feds, the Medicaid money, Medicare money, in order to help fund this? So that's one question, and that maybe either Melanie or Dick could answer. And then the other question that she asked, which I think is terrific, is part of the campaign that Melanie mentioned at the start that you're looking to put together. Will it include canvassing so that we can really help people understand the New York Health Act, because there's just a lot of information we need to share rapidly. So I'll step back and let one of the other of you address those two questions. Thank you.
Yeah, I mean, I'd like to address the second part of it, but just quickly, and I did respond to you, Francesca. I know you put the question a lot in the chat, and Dick can certainly kind of speak to it from a more nuanced perspective. How this is funded is a mix between federal money as well as a progressive tax, right? And I put this in the chat. Studies have shown that over 90% of New Yorkers will pay less than they do now for healthcare, right? Which makes it more affordable. It means working people put money back in their pockets. It's a very good thing. And of course, Dick went over, and I just want to underscore this. I can't underscore this enough when he was talking about the savings of the system as a whole. Right now, the federal government has decided to cut some of the money that we have historically received, some of the money. The New York Health Act would more than make up that gap, right? So we've got a hole in the budget. If we could pass and implement the New York Health Act on a speedy timeline, we would more than make up that gap. So I cannot underscore that enough. That's critically, critically important. And to piggyback a little bit on what Eve said, it's not just cutting from children, right? If they leave this hole in the budget, we're going to see all of what we're projecting from a healthcare perspective, but we're going to see other services decrease as well, right? So it'll be cuts to education, it'll be cuts to infrastructure, cuts to climate resiliency, et cetera, et cetera, et cetera. And so it sounds like there's some concern that the Trump administration might just say, well, we're not going to give you any federal money, right? That has not happened, right? He has certainly been vindictive and harmful and has cut the funds that we receive, but they're not withholding all of the funds. So I think that's an important point here as well. We do receive some funding, and we anticipate that we will continue to receive some funding. And I will just address the canvassing part, and I want Dick, you're very welcome to kind of go into the nuance of the funding. You're certainly better equipped than I. I've put into the chat a couple of times. I'm going to drop the link again. We do have a statewide hub meeting every month. We have regional hubs around the state. We are trying to build them in every region. They don't exist in every region. We are hoping and intend to have hubs in every region. We've got a curriculum for these hubs. And, the campaign that we're running, they are integral to the success of the campaign. But these hubs really kind of have these, regional mandates to help us spread the word from a public education perspective and build the moment locally. And so there are a variety of tactics, including, forums, including tabling, including canvassing, et cetera, et cetera. So we're working with those folks. If you'd like to get involved, please sign up. Our next meeting is actually Thursday night. The more folks we get, many hands make light work. So we'd really love to see you. I'm also just going to do a quick plug if I can, Catherine. We're partnering with our friends at the Invest in Our New York campaign to call for a special session tomorrow, Wednesday, as well as next Wednesday. And I can put the link in to sign up if you're interested in helping us reach out to, I believe we're calling legislators and the governor tomorrow, but I'll put that link in. And then lastly, when we formally launch the campaign, we will be launching with a digital press conference, and we will also have a petition. We are soft launching the petition. If you want to support the New York Health Act, it's for individuals. And so what we're asking is for everybody to sign if you want to see this legislation get passed, but not just sign yourself, but then share within your network. So Catherine, I'm going to ask you to share with your entire peer universe, but we all have folks that are not in our activist circle. So we're going to ask you to share it with your personal networks as well. I'm going to drop that in the link and I will pass it to Dick.
Actually, before Dick speaks, I want to ask you another question, Dick, to answer as well. And that is, someone dropped in the chat, if other states don't do this, how can New York actually do this? In other words, how can we go it alone? But please, thank you for answering that plus the other.
Okay, well, first of all, the federal question. It would be ideal and could be done under federal law if the federal government was willing, which for the time being, they're certainly not. But the federal government could basically give New York the money they were going to spend in New York on Medicare and Medicaid. We would put that into the New York Health Trust Fund, and it would all be administered as a single payer system. But in the almost certain event that at least for the first several years, that's not going to happen, the way it would function is the federal government will continue to spend whatever they were going to spend in New York on Medicare and Medicaid, and the New York Health Act will wrap around all of that. So, for example, if Medicare does not adequately cover the cost of an appendectomy or a broken elbow, which they don't, the New York Health Act will pay more on top of that. Same thing with Medicaid. And if there are people that Medicare and Medicaid don't cover, the New York Health Act will cover them. We've been doing that for decades. When Medicaid began, federal government did not cover childless adults. The New York Health Medicaid from the very start covered childless adults. We just didn't get federal matching money for it. Long tradition of that. The federal government will not let federal money pay for abortion. Well, New York has always used state money to pay for abortion under Medicaid, for example. I'm sure there are people in Congress who hate the fact that we do that, but we can do it. You know, I'm a retired state employee, so I have retired state employee health coverage. When I go to the doctor, Medicare pays a certain amount. My doctor wants more than that. And so my state employee retiree benefit pays the doctor somewhat, a fair chunk on top of that. I then pay a small deductible. Now, I don't know if Medicare even knows that the state is doing that, but we certainly don't need federal permission to pay my doctor on top of what Medicare pays. And so the New York Health Act will function very smoothly on top of Medicaid, Medicare, Affordable Care Act benefits, et cetera. The other question, how do we do this if other states don't? Well, you know, when we adopted Child Health Plus in 1990, there was one other state in the union that had Child Health Plus, Minnesota. We actually shamelessly plagiarized the idea for Child Health Plus from Minnesota. And I suppose people from 48 other states who had children who were uninsured might have picked up and moved to Minnesota or New York. But guess what? There's no evidence that that ever happened. You know, New York has always had much better home care coverage and nursing home coverage than under Medicaid than other states. Is there any evidence that older people or disabled people are moving from other states to New York? Not at all. No evidence of that at all. So am I worried that if the New York Health Act passes, people from, you know, Wisconsin are going to flood into New York? No. You know, when Saskatchewan adopted universal health coverage, did people from Alberta and British Columbia all pick up and move to Saskatchewan? No, they didn't. What they did was they got their province to copy what Saskatchewan did. And a couple of years later, they got their national government to provide matching money. That's what'll happen.
Okay, great. Thank you. Thank you for that. And as we look at the chat, I just want to ask a question about where First of all, who's the leader of the committees in the Assembly and the Senate, and are they advocates for the New York Health Act? And where do the speakers, Stuart Cousins and Carl Hastie, stand on this?
The chair of the Assembly Health Committee is Amy Paulin from Scarsdale. She is now the prime sponsor of the New York Health Act. For years before that, she was a co-sponsor. In the Senate Health Chair, Gustavo Rivera, is a very outspoken supporter of the bill. He's the introducer of it. He was a co-sponsor before he was the introducer of it. But the real problem is that since 2015, 16, 17, and 18, when we had a strong Democratic majority in the Assembly, the bill came out of the Health Committee, passed the Assembly 4 years in a row by about 2-to-1 margins. In the 2018 election, the state Senate flipped from being Republican and controlled by the insurance industry to having a Democratic majority. Since then, with both houses having strong Democratic majorities, with most members of both houses co-sponsoring the bill, what happened? It has not gotten to the floor since 2018. How come? Because once the bill went from being, oh, that's just passing the Assembly, don't worry, it's not going anywhere in the Senate. Once it became a viable two-house bill, the state and local public employee unions all came out against the bill. There's a lot of the labor movement that strongly supports the bill, but groups like the New York State United Teachers, CSEA, et cetera, all looked at it and said, oh, we're not supporting the New York Health Act, we're opposing it. Why? Very good question. I think every concern they've raised about the bill, we have responded to, in some cases by putting in belt and suspenders language in the bill, answering their concerns. There is some reason to think that some public employee union leaders have gotten very comfortable seeing themselves as almost the heads of an insurance plan rather than being the head of a union. But as long as you've got that segment of the labor movement opposing the bill, it's hard to see a legislative body with a Democratic majority in New York State moving the bill. And so to get the bill going again, we need, first of all, very strong public support. But secondly, and we're working on this, we need to try to move the public employee unions into either neutrality or supporting the bill.
Okay, thank you, Dick. I see Melanie's hand up there. Maybe she could address the campaign to try to make that happen.
Yeah, so I'll just say, I try to look at a problem and say, like, there's more than one way to skin a cat, right? And so, we are constantly trying to figure out what moves the needle, right? And obviously we have had resistance, sadly, with some public unions, but we're also like starting to stack up some, heavy hitter unions in the private sector. And like, that's going to influence these legislators and the leaders and the speaker as well, because like, why? I don't know. There's a lot of reasons why they may be impacted by public unions, but let us not forget, just like organizations, unions write big checks come election time, right? They've got a lot of power, right? So I think, yes, we're doing our due diligence and trying to correct misinformation from the public union sector side while simultaneously building up other union support. And I think we're in a stronger position than we've ever been in terms of having union support actively engaging with us and starting to strategize how to find and build more union support. So I think that's really great. One quick point on the legislature. As I said earlier, and I kind of just briefly touched on it, the chambers act very differently, right? And so I know we often think, we for a long time it was 3 men in a room. Now it's like 2 men and a woman in the room that make all the decisions, and it's frustrating, right? Well, why do we have representatives then if they only listen to their leader, right? There's so many other variables. We'd like to think that our representatives are just representing us, but it's just not the case across the board. It just isn't. There are some, certainly. But it's not true of the entire chamber, right? There's other factors like trying to keep the caucus together, trying to protect members in areas where there's swing districts, et cetera, right? And there's all kinds of misinformation. So, for example, in the Senate, we understand that what moves Andrew Stewart Cousins is her caucus coming to her and telling her, we need to move this bill, not just Gustavo Rivera, but real support. And I can't tell you how many conversations I've had with legislators where they've promised me in certain sessions, in certain caucus meetings, they would be outspoken about the bill, only to find out from another legislator that they didn't say a damn word, right? So these are sort of the issues that we have. I think the Assembly seems to operate very differently. There's sort of a very top-down approach. And then there's things like, our bill sponsor in the Assembly is a prolific bill passer. She passes a ton of bills. And so I think there's some question of weighing if she puts all her eggs in the New York Health Act basket, that may mean no other bills get passed, right? Because they will look at a legislator and say, well, we're not going to let you pass 20 bills, right? And so there's a lot of factors that come into play, which is why I keep going back to, in this political moment, our biggest strength is going to be public pressure. And it's actually been shared with me by many legislators who have said, be like the anti-vax movement. Be everywhere, be aggressive, and be relentless, and never stop nagging every single one of us. That is what will move this bill. That is what legislators have told us, right? And so I think we have to be thoughtful about the way we build our relationships, but I think we have to be consistently present.
Great. Thank you. Thank you, Melanie. That's a strong point to end on. I know Martha had her hand up earlier. I didn't know, Martha, if you wanted to make a comment, because we're going to close out shortly.
Just a quick point, and that is that a number of us are working within our own unions as well as in a labor-based group called Labor Activists for New York Health. I've put my email in the chat, livingstonm@oldwestbury.edu, and anybody on this call who would like to figure out about getting a speaker or how I can be helpful in any way, from Poughkeepsie to Sag Harbor, just give me a holler. You have my email now.
Great. Thank you. And I want to thank all on the panel. Cheryl, thank you so much for moderating and bringing these knowledgeable people together. Thank you, Melanie. Thank you, Martha. And Dick Godfrey, thank you for all of your work over the years and for being here tonight to guide us forward. And Eve Creef, thank you for sharing your personal experience. That's really important, because that's where it all happens in the office. And I just want to, someone asked, well, won't we have more ration care with this? And I will just say to that, we already have ration care. So I think that's really a non-starter in terms of an argument. And closing on a positive note, in Assembly District Number 1, Tommy John Schiavone, who is my representative, is a supporter of the New York Health Act, and I know for a fact that several years ago he was not. So he has changed his position. Others can change their position. We have to, as Melanie said, put a lot of public pressure on in order to make that happen. A lot of good links were dropped in the chat. Please save it. We will also send the chat out to everybody who's here, and if there's questions that we didn't get to, we will try to get those answered as well. So I just want to thank everybody who came tonight. The link to the recording of this will also be included when we send out the email. Please share that broadly. And we hope to see you soon, canvassing or calling for the New York Health Act. Thank you for coming tonight.
Thank you so much for doing this.
Thank
so much
you.
for all the contributions. Thank you.